have turned that off. I did now. We'll call the Senate Finance Committee to order, and we have a motion to go into executive session. Senator D'Alessandro, seconded by Senator Rosenwald, go into executive session. All those in favor say aye. Aye. All opposed, nay. The ayes have it. We are in executive session. Page 1, item number 1, Senator Bradley's name is on this one.
Thank you very much, Mr. Chair. So I believe this would complete the discussion on housing. Thank you, Grant. I think this would complete the discussion on housing, hopefully. So just to recap, the House appropriated $30 million for the Affordable Housing Fund and $15 million for Invest in Age. The combination of all of the amendments that we've proposed would equal the House's level on funding at $45 million. $20 million for the Affordable Housing Fund, and remember, there is a $5 million transfer from the real estate transfer tax every year that is outside of this discussion. So the actual money going into the Affordable Housing Fund is $30 million. But for our purposes, it's 20. We have appropriated $10 million for Invest, $5 million for Housing Champions, and then with this amendment, we would do $8 million more out of 23 for the purpose of increasing rates to homeless shelters, and $2 million, similar to an amendment that Senator Khan worked on last year that got lost in a committee of conference, that would go to towns to reimburse them for the services that they provide, whether it's hotels or generally that's what it is, for the vast majority of towns that do not have homeless shelters. So it would get us, it would be the same level of funding of $45 million. That's the amendment.
Further discussion? Senator?
I seconded, but
Well, if we're going to do that, then Senator Bradley moves, and you second.
yes,
All right.
I appreciate this funding. This is the level of homeless funding from Senate Bill 231 that the Senate laid on the table. I think we've seen that it will be very helpful to increase shelter reimbursements from $8 a night to more like $20 a night. It will enable us to bring more shelter beds online. I just wanted to add that I hope we can revisit the Housing Champion appropriation, because we did hear back from Commissioner Caswell on the cost to administer that. He said would be like over $1 million. And I know that the cost of sewer line is $2 million per mile. So $5 million probably won't get us very far. So I hope as we continue on and see where we are with revenues, that we can revisit the Housing Champions, because it's really the only municipal kind of programs.
Yeah, I sort of saw the $5 million appropriations somewhat of a pilot program, see how it works, and I was a little bit staggered by the $1 million implementation cost, quite frankly.
LBA will take a note, and it'll show up in our packets as a hold item right now. Okay, further discussion. Okay, all those in favor say aye. Aye. All those opposed, nay. The ayes have it. We're on to the next number one, Medicaid services. I think that there's still questions out there on that one. I'll let you comment before I put it back on hold.
Okay, so this is relevant to Senate Bill 175. We took up some of it last week. We added the Medicaid coverage for doulas, for the lactation services and the donor breast milk. What we didn't do is the employment support piece that takes effect in 2025. And we also did not fully fund that bill's amount on the family resource centers. And those seem to be important for a couple of reasons. One, cases of neglect have risen. Two, we know that DCYF.
After you're finished, we're going to have allow Senator
Okay.
Pearl for an introduction.
Okay. DCYF referrals are up, but cases closed are down because, as Director Ribson told us, the cases have higher acuity levels. So family resource centers are very helpful in helping families that are unable to feed or clothe their children. They're helpful in helping them find resources. So this amendment just incorporates those two other full funding of family resource centers and the employment support piece, which was part of the Senate's position.
Senator Pearl for an introduction.
Raven. No, come back. Come back. Just for a minute. I would just like the committee and everyone here to say hello to my daughter-in-law and two of my grandchildren, Ben and Ella. I came to visit today. Hi,
Take-
guys.
Bye now.
Thanks for coming in. Bye.
All right, further comments on this item? Senator
So
Bradley?
I would, look, I think what the family resource centers do is really laudable, important. I was mistaken. It had been in 175 at $2 million per year. I thought we'd lowered it to 1 million. I was confused with what the House did. But I'd still suggest we hold on this and see where we're at next week.
If there's no further discussion, we'll move on down the page. Items 1 through 4 on page 1, 1 through 3 on page 1, and the top item number 4 on page 2 are all related. Frankly, I support the governor's position, but Senator Rosenwald, I know you'll want to comment.
I think it was the House that changed the budget to hold county cap flat, not the governor's position. So I'm happy to hear that you support the governor's position. That
Well,
would
the
be
one that keeps it
number
flat.
1 and number 2, right, Kevin?
Right, 1 and 2 are both related, and they would increase the county cap by 2% per year and use the savings combined with the federal fund match to increase nursing home rates.
Right, so, but the governor's position was 2%.
The governor in his House Bill 2, as recommended, had a 2% increase year over year, and the House kept it flat instead.
So I'm happy to hear that.
I modify my statement. I was
Oh.
confused. I thought it was the governors that kept it flat, but thank you for pointing that out.
So, the reason I think this could be helpful is that this committee has cut the Medicaid rate increases by $15 million. Item number 1 and 2, which are related, would basically wipe out that decrease by keeping it where the governor had it, but directing the money to support nursing home rates. So I would like to
And,
move items 1 and 2.
all right.
I'll second it. I'll
Senator
second.
Rosenwald moves, second by Senator D'Alessandro. Senator Birdsall has a question.
Thank you. How will this affect the county taxes?
So
Can you walk that through a little bit?
I think individual counties would have different responses, but to the extent that the cut this committee has made to the House proposal for Medicaid rate increases, I think would be helpful. The county tax is a small percentage of a person's property tax bill. It is there, but it is a small percentage. Nursing home costs are expensive for counties. So I don't think we have individual county tables, but it would bring in federal money and state money to support nursing home rates, which are a big expense for counties.
Senator Bradley.
Thank you. I'm pretty concerned about increasing county taxes. I think that if we were gonna do anything in regard to this issue, it would be to revisit the Medicaid provider rate at the end when we know where we're at in total. I think, characterizing the Medicaid provider rate as a cut when we've actually increased it by $120 million isn't correct. I know some people wanted 200 million, your bill was 145, the House position was 134, the Senate position was 80, now we're at 120. I'd rather talk about somewhere, whether it's 120 to 134 than make any of the adjustments in 1 through 4. But I'm willing to have that discussion, when we see where we're at.
Okay, that would be really helpful, I think. So in that case, I will withdraw my motion.
Since that discussion is going to be done on the Medicare provider rates, then I would label all 4 of those items as no action by the committee and take a sense of the committee to do that. Is that what you're looking?
I'd like to reserve the opportunity to bring them forward.
Okay, you want 1 and
Let me see
2,
where
or
we are.
3 and 4, or both?
Both. Both.
I'm just trying not to put too many things on hold, that's all.
So we're putting items 1 through 4 on hold?
That's what the request from the senator is. I think that if we're promising to talk about this in Medicare provider rates, that I guess the one way to do it is for us to move those items and then vote them down. But I'm trying to get things off our plate. So,
I appreciate that.
moving on, page 2, line 5. And Senator Bradley?
Yes, so this is the, thank you, Mr. Chair, long-awaited amendment that is the result of all the discussions that the Health and Human Services Committee had on Senate Bill 36, Senator Gannon's bill. It creates a system of care for senior citizens in New Hampshire. It's similar to what we did for youngsters several years ago. It is meant to provide greater access, greater availability of services, really designed more than anything else to be information sharing and help people stay in their homes. So there's obviously, if you look at it, there's a purpose statement and a series of definitions. The funding, much of the funding was moved into Senate Bill 86, which is Medicaid provider rates, but there are some funding levels available, and the department can talk about this further if necessary, to phase in the program. I think that was important for myself and members of the Health and Human Services Committee. When this bill first came to us, we sort of said to the advocates and the department, go sit in a room. When the white smoke comes out, everybody will be happy. I think this amendment represents the white smoke, and quite frankly, a lot of people worked really hard to make this happen, and I think that the way that this is being implemented will be realistic, not try to do too much too quickly, but it will definitely benefit seniors in New Hampshire. So with that, I'll stop.
I'll move item 5.
Moved by Senator Birdsell, seconded by Senator Rosenwald. Further discussion? Seeing none, all those in favor say aye. Aye.
Aye.
All those opposed say nay. The ayes have it. And moving on, Senator D'Alessandro, 5, 6, and 7. Your previous statement was that you were going to bring in an amendment to delete them.
I will not bring it in, and I want them funded, and I think that there's ample reason for doing it. They're not expensive. I think it costs us $750,000 for the congregate housing. Excuse me, thank you. $750,000 for the congregate housing and $100,000 for the foster grandparents program. We're talking about keeping people in their homes, and we did that in the last amendment. Well, that's what Sec 6 would do. And 7, the foster grandparents program is $100,000. I think it's $100,000 well spent. And it seems to me if we can fund peers for $150,000 for a study for a peer for $150,000, we can spend $100,000 for foster grandparents. And I'm a grandparent.
You're probably a great grandparent.
I'm a great grandparent too. I got them both covered. But it seems to me $100,000 for foster grandparents and $750,000 for congregate housing. We've funded these in the past. We've suspended them, and I think you are right. The last time we did do it, when I chaired finance, that's the last time we funded them. But the HHS couldn't implement them because of the COVID situation. Okay, and it lapsed. That money lapsed. I didn't like that, obviously. And I didn't like it when they testified and said, but we didn't fund it, which really got my dander up when we did fund it and it just wasn't implemented, instead of saying it wasn't funded. They were funded, they're good programs, and they're programs that in my opinion, are essential. So with that, I would ask that we,
Did you want to move both of them at the same time, or did you
why
want
not?
them separately?
No, I'll
All
move.
right,
both
Senator
separately.
D'Alessandro moves.
I'm saving time.
6 and 7. Senator Rosenwald seconds them. Further discussion? All those in favor say aye.
Aye.
All those opposed say nay. Nay. The nays have it, and we're on to item 8.
Thank you.
Item 8 in the packet, it's page 24. And I had a suggestion that the amendments that's on 24 would do better if it had some rewording. Senator Rosenwald on 20, or line item number 9, we haven't seen your amendment yet. If LBA, oh, you got it? All right, so
Ooh.
we'll
Yeah,
wait for it to
have it.
come through.
That Kevin's quick.
And LBA will correct me after I make a misstatement here, that the wording of the Bradley amendment, I think it is Bradley, oh, Senator Pearl amendment. No, Bradley? Okay, it didn't say there. Would benefit from some rewording to take out the usually initial language that we put into a program. So if you'd talk about what the amendment would be, I'd appreciate that.
The change to 1806?
Yeah.
I think the only thing you would need to do here, so it currently reads on line 5 as though this would be a new appropriation out of fiscal '25. I think you would want to strike that, leave 2023 in place, but add which shall not lapse until June 30th, 2025. So it would still be an appropriation out of '23 money, and the department would continue to have the authority to spend it.
And since we just got yours, Senator, how does yours differ?
So mine is different in that it requires the department to do some reporting on the pilot, starting on line 13, to provide quarterly reports on the number of people who've applied for funding, the number of people who've been approved, how many have been denied, and the reasons. It's my understanding that so far, I think only maybe 2 people have been approved. So the area agencies are on board with this quarterly reporting, and it doesn't change the money or the timing of when the appropriation is made. It just adds some, I think, helpful reporting to help the department moving forward.
So if the money, if the reports that come from HHS, can't we just ask for it in Health and Human Services oversight? Get it there without even changing that? I think we can.
Well, they wouldn't have to.
They would
Unless
if
they
Health and
were-
Human Services oversight asked for it.
They might. This requires reporting to not HHS oversight only, but also fiscal and the policy committees. So it's indicating to the department that we want to be their partners in designing this pilot program, but we also want to make sure that it's set up in such a way that people who are eligible qualify for the services that makes the legislature's intent.
Senator Bradley.
This may be what I would consider a friendly amendment. I also met with folks that asked for more reporting. I think this pilot program came out of legislation I sponsored a couple of years ago, one of the omnibus bills for the department. The only thing I'd suggest would be a semi-annual report as opposed to a quarterly report. I think that would,
I would consider
Be
that
appropriate.
friendly.
so anywhere it says quarterly, I think it
Yeah.
on line 5 and somewhere in here, funds for each quarter, it should be probably funds for each 6-month increment or something like that.
Okay, so what I'm hearing is that
And the
we're gonna-
balance of line 17 through 27 is the same, and Kevin was suggesting a
Yep.
amendment to that.
So lines 19 through 27 would go back and reflect the changes that we did to Bradley. Change the report to semi-annually. And make
And
sure it
online.
makes sense.
Yep, and on line 13, I think,
6 months.
reflects 6-month period
Yep.
rather than each quarter.
Yep. Does it say who they're reporting to?
Up in starting on line 5. So the policy committees, fiscal, finance committee, and HHS oversight.
Okay, does everyone understand the committee amendment?
Second,
Senator Bertzel moves the item, seconded by Senator Rosenwald.
What's that? Yeah, I think we've,
Yeah, we've got that.
yeah.
We've got that. All right. All those in favor say aye. Aye. All those opposed say nay. The ayes have it. And that takes care of 8 and 9. Senator Pearl, you've got 10.
Thank you. Just need to find the notes here. So, I was asked to bring this amendment, which will allow tuition reimbursement for LNAs who want to take the extra course to be an MA. This will help take the pressure off from the RNs and assist with workforce retention and recruitment. The reason this came into us is that the House version of House Bill 215, I'm trying to just read my notes here. The DHHS thought the money could be matched, but the day before the House hearing on House Bill 215, the feds came back and said it couldn't. So at that point, it was too late to put in the budget, and that's why we're bringing this amendment on the Senate side of finance. So this will help with the LNAs to become MAs and help take the pressure off from the RNs with medical medicine distribution.
Senator D'Alessandro.
Oh, thank you. A question of Senator Pearl. Senator Pearl, how many people would this take care of?
You know what, Senator, I'm not sure on that number. Kate, were you here? Couple hundred. Okay.
And LNA's, the length of schooling is a year?
2 years, I think, for LNAs, but this again would bring them up to the medical assistant category, which allows them to distribute medicine, certain medicines, not all of them.
Kate, so that you can be heard by the people in Cyberland.
Thank you, Kate, correct me in all the places that I'm making mistakes.
Thank you, Mr. Chair, members of the committee. Kate Horgan, New Hampshire Association of Counties. I'm sorry, what was the last question?
Well,
What was the length of
Oh,
training?
it's
LNAs
I
received?
believe it is 80 hours.
80 hours?
Yep.
No, the length of training, if you're freshman and you're going to be an LNA, it is 2 years?
Yes.
And then an additional 80 hours would be needed. Somebody's saying no. Who's saying no?
How long, Gina?
Come on up. Come on, sit next to Kate. No, you're
I'll
both
just
of
move
them.
over.
You're both of them?
See, I don't feel so bad not knowing all this off the top of my head now.
I mean,
I don't have my experts with me today, so
And-
I'll
and
borrow
we-
Gina.
We have a couple more seats if somebody else needs to come up. I mean,
Good afternoon, Mr. Chairman and members of the committee. I'm Gina Balkus with the Granite State Home Health and Hospice Association, and home care and hospice agencies employ LNAs, as do nursing homes. So LNAs go through a training that is 120 hours to achieve their licensed nursing assistant. They don't need to go to college. They can go into a program right out of high school. In fact, there are several high schools throughout the state that have LNA training programs. I believe that the amendment that Senator Pearl introduced is for medication nursing assistants. So that's an additional training on top of that 120 hours, and I have to say that I don't know how many hours that is because they are only used in nursing homes,
That
not
one
in
is-
home care.
That one is 80 hours. I do know that it's an additional 80 hours that they're taking.
And Kate,
And-
that's an additional certification, not
Correct.
a license, correct?
Correct.
Yeah, okay.
And believe it or not, somebody will tell us if we get it wrong. Senator Bradley.
So does this just affect nurses in, home care setting, or
No.
is it
It would be for any long-term care setting.
any long-term care? So Gina, your clients, nursing homes also?
So, home care agencies, so generally medication nursing assistants, which have this additional training, are used in nursing home settings. It allows them to administer medications, like at night when there's not nurses on, when there may only be one nurse on staff or something like that. In the home care setting, LNAs do not need an MNA. The law doesn't require it because they're allowed to administer medications through nursing delegation. It's a special process. It's sort of one-on-one. So it means that one nurse can delegate to one LNA for a specific patient. But in the nursing home setting, those medication nursing assistants can administer to any patients in the nursing home with a nurse oversight. So there's nuances between them, but the M&A is generally just used in nursing homes.
If I might add, I believe it's also used in the hospital setting, too.
Oh, okay.
Senator Rosenwald, you were next on my list.
Thank you. How many M&A programs are there in the state, and where are they? Are they part of the community college system, or who's operating the programs?
The counties do have their own training programs, so that's where we send ours. I can't speak for how many there are across the state, though.
Okay, I know when my mother was in the nursing home that there was problems, that on the back shifts for medications, an RN had to come in and all of this, so that did create problems. I think with the shortage of nurses that we've got across the state, that this seems like a reasonable thing to do. I might, cough a little at the price tag, but further comments?
Should we move it into 23?
Certainly that would be acceptable. The thing about moving some of the stuff into 23 is if we are expecting to authorize it in the coming fiscal years, that it could cause you a little heartburn there. And I was going to have a discussion with you on some of the other things that we did at some point in time. But for right now, we can move things back if we need to, if you and I have a conversation, but I'm sure that moving it all into 23 with a note for not lapsing till 25 is acceptable right now. And if we do something different, we'll come back before the committee and do that. Further discussion?
I'll move the amendment into 23.
I'll second.
Senator Bradley, seconded by Senator Pearl, to move $400,000 into FY23, non-lapsing until. All those in favor say aye.
Aye.
All those opposed say nay. The ayes have it. 11. Senator Bradley and Senator Rosenwald. Amendment 1957, page 25.
Thank you, Mr. Chair. So we were both approached by Alex, and I don't see him. Oh, yes, he is. He's way back in the corner. About just a specific child who is in an out-of-state facility that has found a facility in Cheshire County that this child with severe disabilities could be moved to if their bed limit was increased by the one bed that is in this amendment. This actually, from what I have been told, would, for this one child, be a cost savings, and the child would be closer to her family. So hopefully this makes sense.
Senator Rosenwald.
If I could just add to that, it would also allow Cedar Crest, which is that facility, to offer some respite beds to families. It would just open, it doesn't say that, but adding that one bed would also allow not only this one child on a ventilator to be nearer to the family, but allow for some respite for families, and it's only for 1 year. So they would have to come back to the legislature and ask for an extension. So I think it doesn't open up the nursing home bed moratorium, which nobody wants to do. And this seems to be a very narrow exemption that the whole industry plus the advocates are okay with.
Senator Bradley moves, Senator Rosenwald seconds Amendment 1957S. Is there further discussion?
If I could, Mr. Chair, just a comment.
Absolutely, Senator.
I think it's a very worthy cause. I mean, obviously, if you can take care of any child, you want to do that. I think it's very dangerous to do stuff like this. It's extremely dangerous because we are going to have many people who have the same or analogous situations coming to us and asking for a change. Now, in the old days, we could have sent this person to Crotchet Mountain, and they would have been taken care of. And I understand that Crotchet is opening up again and is beginning to take patients. I don't know if that's the case, but has Crotchet been purchased by another entity, and aren't they starting to develop?
Come on up.
Right. Who can give me the scoop on that? You, Christine?
I think Crotchet has been sold. Seven Hills has taken it over, but I just want to do a plug. Cedar Crest has a very specialized care, and this child probably, even if Crotchet was around, would really need to be at Cedar Crest.
Okay. Well, Crotchet had a very special kid also.
Yeah, I don't disagree, but I'm just saying, I don't know the child,
Right.
but based on what I've heard, it really is a Cedar Crest.
Senator Rosenwald.
Thank you. I should have mentioned that I checked through Alex with the people who bought Crotchet Mountain. They said they could not accommodate the child's medical needs.
Seeing no further discussion, all those in favor say aye. Aye. All those opposed say nay. The ayes have it, and we're on to page 3. Item 1, page 3, Amendment 1884. And I guess it's related to 2. Same $1 million, just spread out different. I think this is one we want to hold till the end. Comments, questions?
Yeah,
Senator
it
Bradley.
just creates a system of care for younger children than the current system of care. I think it's designed to be a pilot program. Senator Rosenwald funds it in 24 and 25. My amendment funds it in 23. I think that's the only difference. We both got the language from Senator Whitley. I like some of the other things that we've talked about today, probably a good idea to sit tight on this.
Further comments? Item number 3. Nathan, I think you're going to want to come forward for this one. Senator Bradley. The question comes down to the department getting the money, or health, or one of the service organizations getting the money, and Senator Bradley, you want to define the question a little further, or? No? Hey?
Speak to the program.
Good afternoon. I'm Katya Fox. I'm the Director of the Division for Behavioral Health. You may be familiar with the Recovery Friendly Workplace. It's an initiative that was taken on by Governor Sununu when he took office. It's been hugely, wildly successful. It started in 2018, and it had 25 businesses that were part of this program, which really looks at the workplace and how businesses can establish practices and protocols so that if someone does need to be in recovery, they have the supports around them. And there are varying levels of what happens in a recovery-friendly workplace. It's a program where there's training involved, and Granite United Way currently operates the program, and they have staff that are dedicated, and they work to tailor the needs to the businesses that are involved. There are currently 350 businesses with demand very high to continue that process. So this funding would allow it to expand to those businesses that want to participate and be deemed a recovery-friendly workplace. Part of the expansion will be looking at training and recruitment for individuals who are in recovery for businesses to be able to reach out to. I think I did that.
Senator Rosenwald.
Thank you. Was this a department's prioritized need, and did the governor not put it in his budget, or did the governor put it in his budget but the House cut it out?
In HB2, as introduced by the governor, Section 89 had appropriated the equivalent amount here, the approximately $2 million for this purpose. The House, during the House phase, removed this appropriation. The original appropriation was to the Department of Health and Human Services Governor's Commission on Alcohol and other drugs, and we are requesting here that it be appropriated to the department. Technically, you can't appropriate funds to the Governor's Commission, as they have the authority within the statute to make their funding decisions. Their funds are continually appropriated and non-lapsing.
Follow up?
Yes, thank you. So if this is going to go to the department and then to the governor's commission, does this language guarantee that it will get to United Way for this purpose, or do we need some stronger language?
So at the department, we always discourage from earmarks to a specific organization. This is for a program that has only ever been run. It was started and established by Granite United Way. So there are natural partners in this particular instance. And the money would not go to the Governor's Commission. It would come straight to the department. The Governor's Commission already supports that's the only funding that they have. This would allow us to use this funding to expand the program. So they'd have two different funding sources, one contract. And yes, we would anticipate that would be Granite United Way.
Thank you.
Senator D'Alessandro.
Thank you. Okay, just heard your iteration, but how would you dispense the money? What would it be based on?
So the funding is used to support the staff that go and provide the technical assistance and the training to the businesses. So it's staffed by Granite United Way, so this would expand those staff members to be able to scale it up.
Further question, and do they get back to you as to the number of people who are served?
Yes.
Okay, and how far do you track them?
So they have the numbers. I forgot to bring those this afternoon, but they've tracked it since its inception of how many people have participated, how many businesses are participating, and I'd be happy to follow up with those numbers for you.
Thank you, thank you.
Okay, so the way I read the amendment, the appropriation is to the department for the purposes of United Way, so that money can't be spent for other purposes, so I think that it covers the things that we were talking about. LBA?
It does say on line 4 that the appropriation is to the Department of Health and Human Services, Governor's Commission on Alcohol and Other Drugs, and that language is the same as in the governor's trailer bill as introduced. So I'm not sure, in order to be consistent with what the department is asking for, I think you might want to remove the Governor's Commission phrase on line 4. So it's only appropriated to the Department of Health and Human Services for the purpose of Granite United Way administering, et cetera.
Okay. All right, so the words on line 4, Governor's Commission on Alcohol and Other Drugs comes out. Senator Rosenbaum.
Quickly, I mean, would this amendment allow the department to come to the fiscal committee and transfer these funds for another program if we went forward with this language, despite what your intent is?
I do not see any wiggle room for this. This would be definitely for this particular program. And if the language were to remain, it would be for Granite United Way. So no, there would be no request for a transfer.
Thank you.
Just a question. If it's funds not otherwise appropriated, it could come to fiscal and ask for money to be transferred. If you're not spending this, okay, then that's money that is still in the budget. And isn't there a way that we could fund a different project from there?
I think theoretically, as with any appropriation that's given to any department, they could later come to fiscal and ask for it to be transferred for another purpose. I think that possibility always exists unless it's written into law that they can't do it.
So could I suggest an amendment to this?
And your
Which
suggestion
says
is?
basically that the appropriation now shall not be transferred or used for any other purpose, which is what we did for the Sununu Center replacement facility language. If we really, really, really mean it.
I, for one, may not be comfortable with that. I mean, you know, the department does a pretty good job of pushing, you know, money around to cover all of their needs. And since they're going to have to come to fiscal anyway, you know, and we as the fiscal committee, and I'll put quotes around that since it's not all just us, but I don't see the purposes of limiting it. It's money in the budget. We're going to make it available. Comments?
It seems to me that what is wrong with making it specific? I've seen instances where we have appropriated money to Health and Human Services for specific purposes, and that money lapsed, and that specific purpose was never taken care of. I wouldn't want that to happen again. So I think if it's a worthy program, and we have money to appropriate for it, we ought to tell them, this is what you're getting the money for, this is what you should use it for, and you shouldn't use it for anything else. And HHS comes every time every year, at the end of the year, and comes to fiscal and says, let's move these monies around. These are things we haven't done. Let's move monies here and move monies there. If a program is so worthy that you've come to us and specified where it's gonna go, we should specify it should go there, it will go there, and it won't go anyplace else. And I think it's about time we did things like that.
Mike,
Thank you.
my response to that is that that puts over $2 million out in a fund that if for some reason we don't spend it, by United Way, that I can't do anything else with that funds out there. I can't go and provide whatever services in greater need by putting that amendment in here. And I think that limits our flexibility and the department's flexibility.
But the
Senator Rosenwald had her hand up.
Well, I was just going to say, from having read a lot of transfer items that the department comes to fiscal with as they're managing their budget over the years, they're not going to come and say excess funds are available in the recovery-friendly workplace. It's going to say something like extra funds are available in the Bureau of Behavioral Health because contracts didn't fully expend the money or something. We won't ever see, we won't know that that transfer is made. And I agree with Senator D'Alessandro, if this particular program is so important that the department wants to earmark it, I think we should belt and suspenders it.
Comments from the other senators? Senator Bradley.
I think both Katja and Nathan did a pretty good job of saying exactly what the language says. So while I agree with you in principle, I don't really believe it's necessary.
All right, so what we will do is we've got an amendment to the amendment, all right? We will vote on it first, and that is LBA, read back the last part of the amendment.
Well, is that the
money
part?
Shall not be spent on anything else.
Okay.
It can't be transferred.
Right, it would be the appropriation shall not be transferred or used for any other purpose.
Okay, so we're gonna vote on whether to add that language to the committee amendment or not, right? All those in favor say aye.
Aye.
All those opposed say nay. Nay. The nays have it. We're back to the committee amendment, which is 1939, less the words in line 4 referring to the Governor's Commission.
I'll move off to pass.
Senator Bradley moves ought to pass, seconded by Senator Rosenwald. Senator Birdsell, excuse me. It's the R that gets me in trouble, because I want to call you all by your first names, and so anyway. All right, further discussion. All those in favor say aye. Aye. All those opposed say nay. The ayes have, oh, 2. The ayes still have it. Thank you. All right, item number 4. I think this is another one you need to talk to us about, Nathan.
Of course. I apologize for the late notice on this item. So there was a court ruling last week, as many of you saw in the news, and the department also issued its Mission Zero initiative. As that's been happening on Friday, my team has been going through the encumbrances that we have available, looking just as part of the standard state fiscal year-end close, trying to identify any potential funds that could be used to support a response to the ruling, as well as the ongoing Mission Zero. We identified Chapter 346, Laws of 2019. So this is HB 4 from 2019. HB 2 was vetoed that year. The legislature came back in September, and a $750,000 appropriation was made for the purpose of IEA patients residing in emergency rooms at that time. The department was unable to use these funds as several months following that. In March of 2020, the pandemic struck. The department went into response mode. The hospitals went into response mode as well. And by the time we came out of the clear, none of those funds had been spent. And so in reviewing past appropriations and current encumbrances that my team was identifying, we determined, or we're asking the question as to whether these funds could be used to fund a new initiative, the Care Coordination Initiative, which is essentially, and I'll kind of pause there just to kind of give the background for the financial history, and I'll hand it over to Marissa. These funds would be used to fund 4 positions, and so the language in front of you is requesting to establish 4 new positions as a response. And Marissa, I'll hand that to you.
Great. Good afternoon, Marissa Henn, Associate Commissioner at DHHS. And as Nathan alluded, so last week, the department announced our commitment to Mission Zero, to having a zero boarding list in our EDs for psychiatric care. And as well, you're aware of the department is reviewing the injunction related to this on as a legal matter in terms of the elimination of ED boarding. So all of that said, one of the key things we need to do is to better engage in what is often referred to as care traffic control in the healthcare industry, identifying needs, determining what is the appropriate location for someone to be transferred to based on the unique behavioral health needs as well as their geographic needs, and then coordinating among not only state facilities, but also the designated receiving facilities with whom the state engages in ongoing partnership.
Questions? Senator Bradley and Senator Rosenwald.
So I appreciate the fact that you were able to identify a funding source for this. I think my hat's off to you on that. And I congratulate the department for, trying to work and resolve through the court case. I think we do have a little breathing room with a year. Solution Health, Dartmouth, DRF beds. So I'm going to support this. This language in no way, though, changes the what was in the governor's version of HB 2 in terms of the discharging of and how you commit people and that whole legal concept. This is just funding.
Yes, this is just funding for positions to coordinate among the various facilities and state entities that partner in ensuring these patients get the care they need.
Okay, can I follow up?
Certainly.
So, getting back to the court case, I think that when Commissioner Weaver testified really early on in the phase that we had, I asked the question. I just want to make sure that we're all on the same page, because the ER boarding, it comes from a multitude of problems, and lack of transition beds for discharge. You have adequate funding, is that correct? With the provision that we adopted, I think it was last week, that allowed you to transfer those monies that have been accumulated, right?
Yep, that's correct.
So you have adequate funding?
Yes.
Okay. And is there still funding available for more DRF beds over and above the Dartmouth 5 beds if there was a willing participant?
The 5 Dartmouth beds, those are being funded with ARP funds. We, at fiscal committee last week, the larger item to carry forward, the ARP dollars that had been previously approved by fiscal, was approved. We would need to review all of the existing approvals, the contract burn rates, to identify whether ARP funds are available. So If there was a willing partner, we would have to conduct that analysis to determine whether funds are available.
And there would be a way to go to fiscal to fund that if there was a willing partner.
That is correct, yes.
Okay. And my third question, and I asked this previously too, I believe it's 24 beds at New Hampshire Hospital that are closed now because of the flooding problem. Obviously, that will take a little bit of pressure out of the pressure cooker on ER boarding. Do you have the resources to do everything to not only make the repairs, but to fund the positions necessary to reopen those beds?
Yes, I know that the repairs are underway, and the funding is sufficient for our employees right now in New Hampshire Hospital.
Okay, I got the answers I need. Thank you.
Senator Rosenwald.
Thank you. I don't have an issue about this particular amendment or these positions, but to say I'm kind of surprised to hear the department just now committing to ending the ER boarding crisis, because I think we've been trying to do it for years. But I also think the court was clear that 12 months from May 17th, last Wednesday, patients had to be transferred within 6 hours of the signed petition. So the department's projection of we're going to do this in 2 years, I'll be interested to see how the court feels about that. When I looked at the department's website today, there are as of Friday, there were 45 adults and 17 children waiting for beds. The department was reporting that 33 beds at New Hampshire Hospital were closed due to renovations, and Hampstead has 19 beds unstaffed, 15 offline for renovation. You did tell us that Hampstead is out of compliance with the contract. And so I'm just wondering, given that also we had to carry for $6 million for transitional housing because we appropriated and nobody has stepped forward, when are those beds going to open at New Hampshire Hospital? What is the date? And do we have enough funding in the budget to end ER boarding within 12 months as the court has required?
The overall history.
So I wish there were silver bullets, but obviously, as we've learned over many years, there aren't. That said, as a department for the last several months, we've been working on the Mission Zero initiative, essentially saying these are all efforts that are aligned with the 10-year mental health plan, but need a little extra gas, both in terms of a level of focus and acceleration and resource in order to get us over that hump, thinking very holistically. So we are continuing to review the injunction. What I can say is, of the components announced in Mission Zero, almost all of them we can make headway on in the next few months with your support in positions like this. And so things like Solution Health, that takes time to build that facility. Staffing issues, as you know from your visit to Hampstead Hospital and beyond, are going to take time as we continue to work with the vendors and with the collaborators. I think that the key here is that there's no, it can't be done by the department alone. This is going to require careful collaboration and partnership with all of the providers, all of the hospitals, all of the players, because it is a truly complex problem that is going to require all of us. But I think what we are expressing is a commitment to accelerating our efforts, working together, and getting as many beds online, as well as all the preventive components. In terms of the timeline for E&F renovation, I don't want to misspeak. I think it's, I was going to say, I think it's fall of this year, but Cindy Balbonis,
Yeah,
do you want to
Cindy
speak
Balbonis, I'm from New Hampshire Hospital. November is the expected time for E&F renovations to be complete. And I just wanted to add, on
Why don't you
Friday.
just sit right over there? There's a mic right in front. You can sit.
Sorry about that. On Friday last week, there were 25 DRF beds outside of New Hampshire Hospital that were not occupied. So just in comparison to the total wait list, which is the reason why we're asking for this care traffic control position, or these positions, so that we can better manage the bed use statewide. So in combination with utilizing all of the DRF beds and reopening E&F unit, that would probably clear the queue if we could just staff our E&F unit.
Okay, follow up?
So the
Just so that the
20
other
or
senators know.
25 DRF beds that we have in the state already that didn't have patients in them, are these two nurses and the supervisor and the business analyst, is that going to get those beds open? Or do they also need the staffing at those hospitals?
Those
for
are
the DRFs?
Those are beds that are available. They're not beds that are closed due to staffing shortages.
But what other states have found is that by having a designated coordinator to basically reach out and to say, this is what we're seeing at all of our facilities, report out regularly, compare data, compare geographies, oftentimes that level of coordination can allow for better kind of system-wide focus. So we have the ability to influence a great deal of change. In some cases, we have the authority to compel change, but in this case, it's really about creating that much closer network of coordination with our own facilities, but more importantly, with the private hospitals with whom we have the designated receiving facility relationship that you're referring to and seeing visibly now on our website in terms of data.
Just one more follow-up, if I could.
Just
So
before you do your follow-up, I just want senators to know that right now it's Bradley next, Bertzel next, and then Senator D'Alessandro after.
Thank you. So I noticed that in your proposal, these care traffic controllers would not work on Sundays. How is that going to meet the court's 6-hour requirement? Are people not going to come to the ERs looking for, needing a psych bed on Sundays?
Yeah, we can't quite yet get into that level of detail, but we will be reviewing and can get back to you soon.
Thank you.
Senator Bradley.
So I just want to give the department a public shout out, okay? You folks have dealt with unprecedented situations over the last several years, just without doubt. You're dealing with a 20% vacancy rate among employees. There are huge workforce issues in the state that we all know about, especially in healthcare professionals. The public health emergency was just expired in May. The drug crisis that goes on unabated with fentanyl that's exacerbating the mental health crisis and the homeless crisis. Some of the things, and I'm probably going to forget half of the things that we've asked you to do over the last couple of years, but we've already debated the system of care for kids. Now we're going to ask you to create a system of care for seniors. The remake of DCYF, which has, happened over the last several years, the 10-year mental health plan that you're implementing, Medicaid expansion, which moved from, fee-for-service to managed care, that went from 50,000 to 90,000 and back to 65,000 with the unwinding. And the pilot program that we just talked about, we ask a huge amount of this department. And as far as I'm concerned, you folks do a great job, and we should be saying thank you very much. And that's why I asked the questions, if you have enough resources, because I want you to be able to do the job. These folks really do a good job for the most vulnerable among us, and they should be given a shout out by all of us. Thank you. Sorry for the soapbox, but it needs to be said.
And thank you, Senator Bradley. Senator Bertzel.
Thank you, Mr. Chair. I just have a question. With regards to, did I hear it correctly that Hanson Hospital is not going to be accepting, or not going to be, the renovations are not going to be completed until November?
No, that was a reference to New Hampshire Hospital.
Okay.
The psychiatric residential treatment facility that you toured, Senator, PRTF will be opening on the 30th, so a week from today. Yeah, thank you.
Senator Del Sandro.
Thank you, Mr. Chairman. You know, I can support what Senator Bradley said. I think you do an admirable job, particularly based with back of the budget cuts that are in there every time, and the limitation on the number of people you can hire. If we have limitations in the budget on the number you can hire, how are you going to hire people? But I also look, when we issue a document to raise money for the state of New Hampshire, there are court cases that are listed. Those court cases get this way. They grow all the time. So something is not happening. Something is not happening. Now, I've worked with people at your department for many, 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 many years. Probably before you were born, young lady, I was working with the department. And I'm telling you that the problems that exist today existed 50 years ago when I first got into this business. And 50 years ago, what we decided to do was empty New Hampshire Hospital. We said, get them all out of there. We had 2,000 people there. We had maybe 1,000 at Laconia State School. I used to visit both of those entities. We got them all out. But when you send them out, you got to take care of them. If you don't take care of them, they languish in the sea that's created. That's the outside world. And I think that's what's happened. That's what has happened to us. So, yes, I applaud your work. Hey, you're in the business. You're dedicated to the business. I understand that. My wife's dedicated to taking care of our children. By the same token, if we don't give you what you really need, taboo on us. Two things that I mentioned create the problem. Back of the budget cuts and limitation on the number of people you can hire. That's a problem. Thank you, Mr. Chairman.
And thank you. LBA, did you have suggestions on the language that we find on page 31?
My only suggestion is similar to what I made earlier for another amendment. I think where it has June 30th, 2020 crossed out and adds June 30th, 2025, that reads as though this is a new appropriation out of 25 money, but I don't think that's the intent. I think the intent is to use an existing appropriation, so I would just leave the June 30th, 2020 date in place.
Do we need to add any lapsings?
In this case, it's already non-lapsing, so they're covered.
Department agrees. Okay. Senator Rosenwald.
Thank you. So we've been mostly talking about the front door problem of the New Hampshire Hospital mostly, but we know that there's a backdoor problem too. We've carried over $6 million for transitional housing, but, you know, I hear varying figures of maybe a dozen people who are ready for discharge, up to 60 people who could leave New Hampshire Hospital if there was the appropriate step-down care. Have we so far given you the funding that you need in this next budget to solve the backdoor problem as we're continuing to throw money at the front door problem?
Thank you for mentioning that, Senator Rosenwald. I believe so. You'll notice in Mission Zero, there's a couple components that align with other directions that we see the budget process going that would allow us, we believe, to support efforts like landlord incentives to help ensure that folks who might not normally feel that they can support these vulnerable individuals have that added incentive, as well as additional supported housing capacity, building on the success of the PATH program on our state campus. So I believe so, but I'll see if Nathan has anything to add in terms of other immediate asks. No, I think at this time, just the one at hand to help us with the care coordination function.
All right, seeing no further discussion, do I have a motion?
So moved.
Senator Bradley, seconded by Senator Birdsall. Seeing no further discussion, all those in favor say aye, with the language as amended by LBA.
Aye.
Aye. Okay, opposed? The ayes have it. And moving on to line item 5. Senator Rosenwald, your name
Thank
is
you.
on this one.
So we're sticking with mental health. This is a request from NAMI, who is just, their contract to deliver family support programs was approved, but their funding has not been increased for several years. So this would appropriate $50,000 to keep up with increased staff costs and help them continue to provide the important level of service that they do. But if you want to move it into the current fiscal year, I'd be fine with that.
Senator Bradley, you have questions?
No questions. That's what I was gonna suggest.
Okay. Any further discussion?
I'll move the item.
Senator Birdsall, seconded by Senator Rosenwald, to have $50,000 in FY '23 for the purposes mentioned. Seeing no further discussion, all those in favor say aye. Aye. All those opposed say nay. The ayes have it. I'm going to recess for 10 minutes here pretty quick. But before I do, I want you guys, we are not scheduled to have a meeting on Wednesday right now. I don't know that we need it, but, you know, what I had intended on doing is that if I get into Tuesday, or there's something that LBA or somebody wants me to, then I was going to recess Tuesday's meeting into Wednesday at time certain. But again, I want you guys to start thinking about that, whether we need that. We will be meeting on Thursday and Friday with the notices that are already out. But that time is available to us if we need it. As long as I recess to a time certain, I don't have to amend anything. But, you know, we might put out a notice anyway, but as far as I know, the requirements are that I can recess to a time certain. That, again, all those things that we can start talking about. When we get to Wednesdays, though, since we don't have session this coming Thursday, the afternoon probably is available to us because we're probably not caucusing, you know, but again. So with that, I want you all to think about that while we're taking a little break, and we are recessed for 10 minutes. Turn. We'll call the committee out of recess. Just a heads up, there's a couple items that want to take up at the end. Just to give you a heads up, the Innes Amendment 2023-1790S, which talks about the Housing Appeals Board and some of the actions that we took about positions. We're going to talk about those at the end today too. And since you weren't part of the conversation, if there's anything that you want to bring up at the end today that to talk about actions, we will do that at the same time. And I don't think that'll take us long. Okay. Well, you haven't got your mic on, so nobody heard you but me. So.
Me?
I'll bring up the foster grandparent program in the congregate housing. Get it on the air, get it on the air.
And who's going to be the person that moves reconsideration? Yeah, you can't. So, she didn't vote in the affirmative on the previous. All right, so we're on page 3. We're at the Office of the Commissioner, and Nathan isn't sitting up there anymore, but you don't have to. It's probably easier with your computer and everything, but it's up to you. Okay, who would like to speak on line item number 1?
So I'll just briefly describe this. Number 1 would be consistent with the vote you took last week on another section. House Bill 2, as passed by the House, incorporated parts of a bill relative to data privacy within HHS. And due to funding limitations, the department is requesting that certain parts of those sections be delayed by 1 year. So the only change here, this amendment is on page 32 of your packet, and the only change is to the date on lines 20 and 21. It's being moved back from July 1st, 2024 to July 1st, 2025.
Second.
Senator Pearl moves. Senator Bradley seconds. Further discussion? All those in favor say aye. Aye. All those opposed say nay. The ayes have it. And we're on to number 2. Senator Rosenwald, Amendment 1740.
So number 2 and number 3 relate to the same sections of the House Bill 2.
Yep.
I'd like to discuss number 3 first, if I could.
Yes, ma'am.
The House, well, let me remind the committee that I am a member of the Prescription Drug Affordability Board. It's got some legislators on it. It also has a member of the Insurance Department, Dr. Aziz, and a professor from UNH and someone from AARP. It has rules approved. They were approved in December. At GELCAR, before they approved the rules, GELCAR said, gee, maybe there's a problem with the fees because the fees are not necessarily directly related to a benefit to the groups that are paying them. But it's not dissimilar from the LCHIP program, where when you transfer a deed, you pay a fee that goes to purchase or renovate culturally significant properties. It's also not dissimilar from the domestic violence program funding, which is a fee on the marriage licenses. And last week, I think it was last week, maybe it was the week before, we talked about the motor vehicle record fees, which support a few things, but one of the things it supports is Homeland Security. So House Finance decided that that was a problem and that the information this group would get was duplicative. The insurance department has said it isn't duplicative. This transparency on the tens of millions of dollars we are spending every year on prescription drugs between Medicaid and the state employee and state retiree programs, this transparency is not duplicated by other programs. So number 3 deletes those sections that the House put into House Bill 2. And that is one way we could go. Number 2 suspends the fee and penalty provisions for the biennium so that there would be time for the board to find a different ongoing funding source beyond the provision that the House put in, which was $250,000 of general funds. So I don't know what the desire of the committee is. I'd be okay with either approach, but to delete the authority of the Prescription Drug Affordability Board when this board is functioning, and we have gotten advice from our attorney at the Department of Justice and had rules adopted, I don't think is wise or prudent for management of the state's resources.
Further discussion? Senator?
I don't know if this has I'm not sure this is relation to the amendment, but looking at the House version, they fund the executive director for only 2 years. I don't get that. How can you only fund a position for 2 years and expect someone to be take that position?
Senator Rosenwald, you have an answer?
I think it's going to be very, very difficult to recruit for that position, which is why we might want to just delete the sections that the House put in.
Further discussion? Senator Bradley.
So I thought that the way the House developed this amendment that was put into HB2 on a bipartisan basis sort of addressed some of the concerns that some have raised about the fee structure. It is a general fund expenditure, but I think given the, what you've talked about in the cost of drugs, it's a worthwhile expenditure. I would note that the same legislation that created the Prescription Drug Affordability Board allowed for a reverse auction for drug purchasing in New Hampshire, as I recall. And the recent federal law allows Medicare to negotiate with the providers for drugs. So there's been a lot of activity on that. So I think that what the House came to is a good solution and something we should support. So that's where I am.
Senator Rosenwald.
Thank you. I respectfully disagree. I'm happy that Medicare is going to negotiate on 10 prescription drugs, but it's only 10, and it's only Medicare, which is not a state expense. I think we take a step backwards by repealing a way of funding the activity of the boards that all other boards have. And that's why we have an option to suspend what the House did rather than repeal what the House did, or repeal the authorities of the board. We could suspend it and give ourselves 2 years to figure out a different approach to funding, which would be item number 2. So if that was the will of the committee, I'd be okay with number 2.
Did you want to speak? I tend to agree with Senator Bradley taking no action on the amendments 1740S and 1596, but if you do want to offer the amendments to get a vote, certainly it's your prerogative, Senator.
I would like to, because I think we,
Which one would you like to
well,
move?
let me move forward with number 2, because I think we owe the people of New Hampshire transparency on drug pricing, for which we spend literally millions in the Medicaid program. Prescription drugs, if you take out hospitals, basically they're number 2 or number 3 as a cost driver. And it's a big expense also for the state health programs, where it's not just the drug manufacturers, but it's the middlemen, the pharmacy benefits managers too. It's complex, it's expensive. All this board will bring more transparency into the process so that we can make better decisions. But the House action will really, really hamper our ability to know what we're actually getting for the millions and millions of dollars we spend. And I think it's worth at least discussing this with the House in conference.
Senator Rosenwald moves
I'll
amendment 1740, seconded by Senator D'Alessandro. Is there further discussion?
I'd like a roll call, please.
We'll call the roll.
Senator Bradley?
No.
Senator Gray?
No?
Senator Rosenwald?
Yes.
Senator Pearl?
No.
Senator Bertzel?
No.
Senator D'Alessandro?
Yes.
The noes have it, and the amendment is defeated. Did you have any further motions
You mean on the other one?
on 3? Other than that, we will take no action.
No.
Okay. Line number 4. And that is Amendment 1865. I'm told that we're going to pull back from the cliff. Would you like to speak, Senator Bradley?
Yeah, thank you very much. I can't recall the number of the bill. I apologize for that, but it's a bill that we have on the table. It was sponsored by Senator Lang that creates a study on the cliff effect, and it appropriates $200,000 for that study to take place. I think, given the workforce issues that we're facing, and I think the testimony that the committee received about, people being forced, if you will, to not work as a result of potential loss of benefits, we should look at it. It is for a study, a relatively significant appropriation. Nevertheless, though, it, encompasses many different benefits over different programs. So I think that's why an appropriation is warranted.
Further discussion? Okay, Senator Bradley moves and Senator Pearl seconds. Seeing no further discussion, all those in favor say aye. Aye. All those opposed say nay. The ayes have it. And we're on to line item number 5. Mr. Monahan, I think there's going to be somebody that's going to ask you a question. If not, we're going to make you relocate anyway, so. You can sit right down there at the end.
Thank you,
Okay.
Mr. Chairman. Happy to answer any questions or.
We have Amendment 1952 and 38 in the package. Senator Bratton.
Yeah, this was the last piece in Senator Gannon's bill, Senate Bill 36. It wasn't picked up in the amendment that we voted on an hour or so ago. Mr. Monahan approached me before the last break, and he said he didn't feel it was necessary, but I'm not exactly, I guess I would want him to tell all of us why he doesn't feel it's necessary.
Yeah, actually, this was a section that was part of a committee amendment to Senate Bill 86, which was the Senator Rosenworld's workforce bill. That the original, as introduced, it created the bill created certification for community health workers. That was turned into this report that OPLC and the department would put together. That was back in February, and I think we have been overtaken by events where stakeholders are already meeting to potentially develop new legislation for next session. So I think the fact that that work is underway would overtake any work that OPLC and the department would do. And with the reporting deadline of July 24, it could confuse things if separate legislation comes in next year. And so I should also mention I'm here today speaking to this on behalf of Bi-State Community Health.
Any follow-up? Department?
No concerns.
All right. And it seems like we're
I mean,
looking at
if
not
there's going to
taking
be
action.
further legislation, I don't know that we need to, like you said, take action.
All right, sense of the committee, take no action on Amendment 1952. All those in favor say aye. Aye. All those opposed, the ayes have it. The committee will be taking no action on that. All right, first thing I want to take up is.
Can I
Absolutely, Senator.
ask Nate a question? And it may involve Katya also. So there's a contract, the Rapid Response Access Point contract. The call volume has been higher than anticipated. The contract's up for renewal. Is there the possibility of, some funding source outside of general funds that we might be able to renew the contract, but also renew it at the higher volume? So that we didn't have to fund it with general funds, I guess would be my question.
So again, Katya Fox, Director of the Division for Behavioral Health. You have been very responsive to our requests in carrying forward funds. If you notice, that language provides, so for the 23 funds to be carried forward into 24 and 25. And that was previously very specific to transitional housing. We've asked that you allow the language, and I believe you included language that it would be for other programs as well. So that's one piece. Secondly, the New Hampshire Rapid Response Access Point, which is essentially the call center, has had more volume than originally projected, which is great because people are using that service. We have worked with the contractor and we understand the situation. They need to go forward with a contract with July 1st, just like any other contractor who has a contract expiring at the end of this fiscal year. Should there be an opportunity to identify additional funds, we would do that. We don't have to be bound to that 1-year period or 2-year period. We could add funds. With Director Littman sitting behind me, we are looking at leveraging Medicaid, which has at CMS at the federal level has offered an opportunity for an enhanced rate to cover the costs of that very function, that administrative function. And so we would need to work to submit a state plan amendment, but that enhanced rate, first of all, we're spending all general funds. So with this, we would be able to leverage that enhanced Medicaid rate. And I'm not sure what the actual split is, but we want to do that, and that would free up general funds for that purpose.
Okay, thank you very much. All right, well, I'm going to move on to the amendment provided by Senator Innes and Senator Waters. Pardon, Senator? The amendment is 1790. It was provided to you before. Anyone that doesn't have a copy, this is the one that changes the title of the Housing Appeals Board to the Land Use Board. I propose that the committee take no action on this item. I'll open it up for discussion. Senator Pearl.
Thank you, Mr. Chair. I also have served many years on my zoning board, and I have some real significant concerns about changing the name on this. The name change I could live with, but the expanded powers of the board I have some concerns with, so I would agree with you on taking no action.
Senator Birdsall. Whoop. Senator Bradley first, I guess.
Oh, go ahead.
Senator Birdsall.
I actually have some concerns about this too. It's, most of my planning boards and my zoning boards are vehemently against the Housing Appeals Board as it is. But then when you start adding powers to it, I think they would go have a conniption fit. So I'm not going to be supporting it.
Senator Bradley.
So I did support the Housing Appeals Board. I think it's worked as intended. But I think broadening the scope of it is way premature, especially in light of the fact that I believe, will be authorizing a new Superior Court judge in the budget, HB1 and HB2, that is meant to expedite the land use docket. And I think that's the more traditional way of dealing with these land use decisions. I think since that has garnered broad support, expanding the Housing Appeals Board is really premature. So I think we should dispense with it.
All that being said, there's only 2 senators left. If neither one of you want to make a motion, then we will vote on taking no action on Amendment 1790. All those in favor of taking no action say aye. Aye. And there are no noes. Okay. Senator Bradley, you have an item.
Yeah, I would like to reconsider our vote on Amendment 1941, which I believe we did on Friday afternoon.
And the chair seconds.
That is the amendment that took back some vacant positions when we traded for new positions. We had a long discussion about it the other day, and we voted for it.
If you just suspend for a second, Senator Bradley, you have a motion to reconsider. And I've already seconded it. You can second it if you want. All those in favor of reconsideration say aye. Aye. All those opposed? The ayes have it. Senator Bradley.
Okay, so we had a long discussion about it. The purpose of that amendment was to try to create some cost savings from all the unfilled positions that we have across state government. It's, they're roughly 20% vacancy rate. And so my thought had been to try to generate some savings. As we heard a little bit on Friday afternoon, when you mix general funds, other funds, federal funds, highway funds, any fund you want to call it fund, it becomes very complicated. And I think there are other ways to generate the savings through lapsing, because if you have 20% vacant positions, even with the pay raise that I think we're going to support, or at least I hope we are, and that will address incentives to retain people and hopefully hire people, there are going to be the savings that I was trying to get at through lapsing. So I would actually ask the committee, we already have reconsidered it, and I would say that we should vote it down. This is the definition of what Tim Lang calls a cottywomple, which is when you try to go to a place where you think you know you're going to, but you maybe didn't end up where you wanted to go. And I think it was a good discussion that we had, but I think it's probably better that we try to get the savings through lapsing as opposed to what I proposed earlier.
Further discussion? Okay. The motion in front of us is to,
I think pull the amendment because we voted for
so
it.
that if we take no action, I think that we are back to where it
Right,
was.
because I think you've already approved it, so you would be voting now to remove it.
Well, we voted to reconsider so that that approval is no longer in effect.
See, yes, I
So
agree.
as long as that's no longer in effect, then it is not approved, and taking no action will do
It'll
exactly
never
what
show
we're
up.
talking about.
And Senator
So-
D'Alessandro does not have to stay up wishing he had Bradley's chocolate chip cookies, looking for that provision in House Bill 2.
That provision would be in limbo.
In limbo.
No, it'll be gone.
All right, sense of the committee to take no action on that item. All those in favor say aye. Aye. All those opposed say nay. The ayes have it. We will take no action on that. Next Wednesday, this coming Wednesday, 2 days from now, through Deb, I've got a request from the LBA to take the day off because they need to catch up with us, which sounds like a reasonable request to me. I do want to remind the committee that the 30th is coming up very soon. That's our last day to take action. We need to get as many of these things off our plate as we can. So with the items tomorrow, and then on Thursday with education's coming in on Friday, is that right? So there'll be a rousing discussion there. Monday will be a holiday, I believe, and everyone will have a day off. But Tuesday, if there's anything remaining from Friday, bring your blanket, your pillow, and your stuffed animal, because we're going to be here for a while, okay? Anyone else have anything? With that, I'll take a motion to come out of executive session. First and seconded. All those in favor say aye. Aye. All those opposed say nay. The ayes have it. Our business of the day being complete, we are adjourned.